Call the June 7th Health Committee meeting to order. We'll start off with public comments. Hearing none. Agency reports. Here. D, the ICPHD report.
Okay. I have a lot of information to share with you today, so I hope that you'll bear with me. First of all, thank you for the last couple of meetings. I've had Terry attend in my absence. During the last health meeting, I was speaking at the state conference for the Illinois Public Health Nurses Association. So I appreciate that you let Terry come and give those reports in my place. If you look over the program summary report, one thing I'd like you to note is that our new Associate Sanitarian, William O'Rourke, has been training with Terry and Donna and doing a wonderful job. He's learning quickly, and I'm very sure he's going to become a very valuable asset for ICPHD in assuring that Iroquois County residents have safe food to eat and safe water to drink. If you look as you look through the summary report, over food sanitation and water samples and wells, private sewage disposal, solid waste, etc. This is a long list of programs we provide. Not all the programs that we have at ICPHD are on this list, but these are the things that are measurable. So I like to provide that for you to give you an idea of what we've been doing. If you'll know, the West Nile virus surveillance reports don't have any activity from December through May, but we are now coming into mosquito season, and so we'll begin that surveillance, this month in June. I received a notice yesterday from Lynn Harriman, and Dr. Harriman is the Illinois Department of Public Health Director for vector control. And Illinois now has its first human West Nile virus case, which is very early for the season. Typically, we don't see human cases in Illinois until late in July or early in August, but we are already seeing that. So Iroquois County Public Health Department will be focusing efforts on this area to decrease exposure and to increase public awareness on how to eliminate mosquito breeding grounds, such as containers and bird baths and old tires, things like that, and ways for people to avoid mosquito-to-person exposure, putting screens on windows, wearing long sleeves, using insect repellent, all those things. But we're going to be doing a lot of education, campaign, and media releases over the next few months to make the public aware. We typically do that in July, but we're going to start that early this year because obviously there are early cases in Illinois. That kind of leads to the question of Zika virus. We do get a lot more phone calls than I anticipated regarding Zika virus. So what we do is spend time with the public, educating them so that they can make an informed decision about whether they are at risk. But that usually involves traveling to South American countries. As of May 11th, there were 17 laboratory-confirmed cases in Illinois of Zika virus. All 17 of those were travel-related. There was no locally transmitted cases. But we're still doing a lot of education. I just brought it in case anybody wanted to look at it. I did a PowerPoint presentation last Friday at the fairgrounds to the camping club. That's a very large group of individuals who came out at the fairgrounds. They were very interested in Zika virus. I presented for about an hour, and we had probably a good half an hour of questions.
What age group is that?
Most of those are retired individuals. But they were, very interested in Zika virus information. One of the things that I pointed out to them was that one of our main concerns is not that the mosquitoes will travel up this far in a year's time. We're not sure that that will happen. I'm not saying that it won't. But if you look at when West Nile virus first became a problem in the United States, it was diagnosed in New York. We were told at that time that it would take a decade for it to go coast to coast across the United States. It took 14 months to go coast to coast. So we don't have any illusions that this is never going to hit Illinois. We just don't know when and where. We're lucky enough to live in a climate where it gets cold in the winter, and hopefully that will help control our own climate and help control some of these cases. But one of the things that we are concerned about is that returning travelers will be infectious with Zika virus, will come back to Illinois, and then will infect our local mosquito population. So in other words, they'll travel back, they go home, and they're infected with Zika virus, they go outside, and one of our local mosquitoes, bites them, becomes infected, and then spreads it, in our area. So we're not naive enough to think that that's not a potential. So we are still going to focus a lot of our education efforts on Zika virus, even though it tends to be more of a problem in the southern states in South America for sure. I did want to show you guys, or point out something else that I found very interesting. When I was doing the Zika virus presentation, I researched where these 17 cases had traveled to see if they were all coming from specific countries. But in the 17 cases that were confirmed in Illinois residents, all cases had traveled to areas with active Zika virus transmission. 10 were non-pregnant females, 3 were pregnant at the time of diagnosis, and 4 were males. And the cases had traveled to these countries. 5 of them had traveled to Haiti, 2 to Honduras, 2 to Puerto Rico, 1 to Barbados, 1 to Colombia, 1 to the Dominican Republic, 1 to El Salvador, 1 to Guatemala, 1 to Mexico, 1 to Nicaragua, and then 1 person had been to multiple Caribbean islands. So I thought that was interesting because it says that this isn't located in the southern regions in one location, it's all over. So I thought that was very interesting. Today at least 1,168 Illinois residents are tested for Zika virus. We are fortunate enough in Illinois that our samples now do not have to go to the CDC like I had reported to you in previous months. They can go to the Chicago lab. The state lab in Chicago has the capability of testing now for that, which is good for us because if we suspect that someone has returned from a traveling country and they have signs and symptoms of illness and we want them tested, we can get those results very quickly and then implement control measures that will help prevent a local spread. So that's at least some good news. If you continue to look at the summary report,
I have a question about Early on, I saw a report that indicated to me that there's a difference in variety of mosquito.
yes,
Is there or?
there are. The Zika virus is carried by the Aedes mosquitoes, whereas a lot of the West Nile virus is carried by the tiger mosquitoes. Those mosquitoes are different, and actually the Champaign-Urbana Public Health Department is working with the University of Illinois epidemiologists and their public health school, and they are developing ways to test the mosquitoes for presence of Zika virus. So for us, for our surveillance, like when Terry sets 78 mosquito traps out in the country and then goes in the mornings and picks them up, he will bring them back and he separates out, literally with a little fever, separates out the mosquitoes that carry West Nile virus from the other mosquitoes. And then those are the ones that they test. Well, Champaign-Urbana Public Health Department is going to be doing that and testing the Aedes mosquitoes for Zika virus. They have had AV mosquitoes in their tracks before. To our knowledge, we haven't had any in Iroquois County, but in years past.
And
But
the others can't carry? Or
so far, they haven't been known to carry, at this point. We know how things in our environment need to change to survive, so we won't say that they won't in the future, but. Do you guys have any other questions about West Nile or Zika virus? So if you look at the community health section, if you look at especially the year-to-date numbers, I want you to know that our nurses are prepared for the increase in childhood immunizations. Typically, June, July, and August are when we'll see most. We've given 173 year-to-date since December, but we'll give that many at least over the summer. Animal bites typically will increase over the summer for obvious reasons. If you look, we have a slight decrease in our chlamydia cases, which is good. We've been working very hard on surveillance and control measures and education to prevent the spread. So I'm hoping that we don't see a rise in those again. You can see that we had one gonorrhea case this month. Typically we see those in the summer months and not during the winter months, but we did have one of those. And then also our hepatitis C case investigations jumped up in May. And we're working diligently to implement prevention and control measures, as well as education to prevent the further spread of those things. We also had our first pertussis case for this fiscal year. Pertussis is whooping cough. We know that it's out there, it's prevalent. Typically, to be quite honest with you, we don't have a lot of physicians in Iroquois County who routinely test for that. I think if there were more routine testing, we'd probably find more cases. But we did have that investigation. For tuberculosis, we haven't had any new cases to investigate, but the state continues in every TB message that they send to us to remind us that TB is on the increase. And Illinois has recently had its first case of XDR TB. Now we've had MDR, medicinal resistant strains of TB in Illinois, but we've not yet, we recently had its first XDR, which means it's extremely drug resistant and most antibiotics will not work on it. So, just to give you a little information about that case, that came in a county not too far from here. And what happened was, the client presented at the health department and had a TB skin test. It was positive. They had a chest X-ray. It was positive. They sent in sputum samples. They were positive. And then they later found out that the patient was fully aware that they had TB. They actually lived in another country, and the family sold all their belongings and traveled to the United States because they know that the U.S. has better care of TB clients. So what had happened during this whole process was, the way that you get an XDR case is typically they build up resistance because they didn't finish their course of treatment, and then the strain mutates and builds up antibiotic resistance. So this person ended up having to be isolated in a negative pressure setting, which was very costly to the health department. They ended up having to be flown in a private plane to a TB treatment center, in another state. This TB case, just in itself, the one person case, cost tens of thousands of dollars to the health department, and the costs were still rolling in when they were talking to us about that, and that was in the middle of May. Since that time, several family members of this individual have now turned up positive, and they're investigating those cases. So one case of TB can be detrimental financially and very scary for the community and the workers who care for them. So they keep telling us it's not a matter of if this will happen, but when it will happen again. So it's important, I keep stressing the importance of having a reserve fund, because we have to have money. If you have any type of a TB case, the state mandates that you provide direct observation therapy to prevent an MDR or an XDR case. So in other words, a nurse from the health department would have to go every single day to that person's home and give them their medicine to make sure that they're completing the medicine regimen and not letting that person develop a medicinal resistant strain. So it's very costly. You can also notice on our summer report that our lead screenings are increasing. I don't know whether or not that has to do with everything that happened up in Flint, Michigan, or whether it has to do with the situation going on now in Galesburg, Illinois, with the water testing positive for extreme amounts of lead. But I can tell you that we're diligent in screening children, because the developmental delays in children with high lead levels is unbelievable. Very frightening. So we'll remain diligent in that and encouraging parents to get their kids screened for lead. We're increasing our education presentations. That's one of the goals that I have as an administrator for the health department, is to make sure that we're out there educating the public. There are so many health-related issues out there that people just aren't aware of. And if we don't make it our job to make people aware, then they do not know how to implement preventative measures so that they can avoid a communicable disease or a health problem. So you're going to be hopefully seeing these educational presentation numbers increase, because that's one of the things I really want to focus on. One of our IFLINE goals is HPV, the human papillomavirus. HPV is not a reportable disease in Illinois, but it's a very serious disease. We recently attended a training, and they told us that if HPV continues to increase at the rates that it's increasing presently, that by the year 2020, which is only 4 years away, 50% of teenagers through age 26 will have been exposed to HPV, the human papillomavirus. That's the virus that causes cervical cancer, and it's also the virus that causes genital warts. We are going to, this summer, focus on educating the teenagers and the parents about the risks of HPV and promoting the HPV vaccine. This is one of the actual cancer prevention vaccines that's out there, and we want people to be aware of the prevalence and seriousness of this virus. Another thing that we're going to try focusing on this summer, and I just went to a training last Thursday on June 2nd in Springfield, and it's about the opioid crisis, specifically heroin. A few of the board health members were asking, if there were anything that the health department could do to help with this problem. And obviously, we're not going to try to do the kind of interventions that mental health does with treatment and recovery. But I think it's important that as a health department we promote awareness and education about the true problem and how bad it has gotten. And it has gotten significantly worse in Iroquois County. I asked Sheriff Hagan, and he did confirm that it's getting worse and worse. So we want to do things like educate parents on how to talk to their children about resisting the temptation of drugs, things for parents to look for in their children if they suspect that these things could go on. Even if they don't suspect it, there are things that we can educate parents on so that they know what signs and symptoms to watch for.
So, Chief, that's a big problem with that.
It's an unbelievable problem. And it's so much worse than I even thought it was. I have to admit, I was one of the ones who was shocked when I found out how prevalent this is. But we're going to be focusing some of our efforts there as well on education. If you flip the page over and look at senior services, For our senior service program, you'll note that adult protective cases are increasing. We've seen a lot of exploitation of the elderly, abuse financially, physically, and emotionally in residents in Iroquois County. So we're working diligently to get those cases investigated and turned over to the proper authorities. One of the things that's not on our summary report that's really not measurable is our public health emergency preparedness program. We had our big audit. It used to be called an LTAR, Local Technical Assistance Review, but it's a big audit. We had Carla Little from the state and Lynn Reagan, who's the Regional Emergency Preparedness Coordinator for IDPH, come to do that. They were very, very pleased with the work, the tremendous amount of work that Eric Stacy has done with this program in preparing Iroquois County in case of the event of a natural or biological disaster. He really has these strides in helping us to become prepared. So that's it for the summary report. Do you have any questions about that? So the next paper that I gave you was the summary report for the programs that we subcontract to Iroquois Memorial Hospital. If you'll notice, beside it, WIC, Women, Infants, and Children Program, you'll see the number 557. That's the assigned caseload. And then the numbers as you go across are the caseloads that they've been carrying every month. Right now for WIC, they have a caseload of 414, which is 74% of their caseload. That may not seem like a lot, but let me tell you that 74% is higher than the state average. So they have a significant caseload. For family case management, they have a 90% caseload, and then they're at one family below their maximum for healthy families in Illinois. And they just had some families that graduated from the program and one that aged out, and then two families that moved. But those will be replaced with new families very, very quickly. Which kind of leads us into our grants and contracts. Typically, I give you a sheet of paper that looks like this every month with the grants and contracts. I didn't prepare one for you this month because the only new contract that you're going to see on there at this point in time is the Local Health Protection Grant, which I submitted in May. The Local Health Protection Grant remained level funded at $63,201, so it's the same amount that has been the last 2 or 3 years. As far as contracts go, Unit 9 schools have always signed 2-year contracts with the health department, and this year they opted for a 3-year contract. The contractual amount did increase a little bit. That's because the coordinated school health grants went away, over a year ago, and that helped supplement travel mileage. Especially when the school nurse travels down to Woodland for Watsika and so forth, and help supplement some of those education programs that we do in other county schools where the Unit 9 school nurse is allowed to leave the school and travel to another area. Milford School contract I have submitted that to Mr. Hastings, and he's taking it later on this month to the Milford School Board. I gave them also the option of a 2 or 3-year contract at the same rate, to lock in a rate for them. In June, the only grant right now that's sitting in the state grant system, grant, is the Public Health Emergency Preparedness Grant. Now, 2 or 3 months ago when I was here speaking with you, I told you that the federal government had appropriated $50 million out of public health emergency preparedness specifically for Zika virus. So obviously our West Nile virus grant went up and our PEP grant went down a little bit. We were told that our PEP grant would decrease as much as 10 to 12%, and it didn't. It went down $1,700. So I was very happy with that. Very pleased. But we are going to be having most of these grants are implemented July 1st. So over the next few weeks, we're going to be inundated with grants and be writing grants left and right. And so next month I'll have a new list that'll be updated, and I'll let you know what's going on with all that. Typically, those grants come out in April and May. But because there was no state budget and allocation amounts were assigned to those agencies did not give us those grants early. And a lot of the grants are going to come in with appropriation amounts that may or may not be on us, depending on what the state budget is when it comes out. So we're very conscious and aware of that and making priorities at the Iroquois County Public Health Department on how to spend those funds. I wanted to make you aware, here's a big issue that I wanted to make you aware of. There are some developments with grants that are subcontracted, especially the ones that are effective for us are the ones at IMH. First, let me let you know that the federal GATA, G-A-T-A, Grant Accountability and Transparency Act, requirements are going to be adopted are in the process of being adopted by Illinois. So typically that's a very good thing. Anytime that there's grant accountability and transparency, I think that's a good thing. But there are some things that we didn't expect that are happening. The first one is indirect cost rates. So all grantees now have 3 options for indirect cost rates in the state of Illinois. First option is that you can use a previously federally negotiated indirect cost rate, which you don't have to county health department. The second one is you can apply for a state negotiated rate for your indirect costs. And the third option is that you can use the federal de minimis rate of 10%. Well, I'm very fortunate to have enough grants and to be able to spread those indirect cost rates over many grants that in looking at all those, I have determined that I would not need a federal, an indirect cost rate for Iroquois County Public Health Department over 5%. So that's good. So I knew that would probably get approved at the state level and so forth. And then we were notified on the 25th of May, so just very recently, they had an indirect cost rate webinar for all state communities. And during this webinar, we learned that indirect cost rate, whichever one of those 3 that you choose, are significantly impacted if you subcontract a grant. So you can only use the first $25,000 of any grant in your calculations for your indirect cost rate. In other words, our biggest grant that we subcontract with IMH is Healthy Families Illinois. That's a $184,000 grant. We're only allowed to use the first $25,000 in our indirect cost rate, which means if you subcontract. Now you can use 100% of grant money if you are the grantee who is also administering and providing the program. I can understand why the state is adopting that federal regulation, but unfortunately for people who subcontract complete services, it's very unfortunate because even though I was paying 0 indirect cost rates for Iroquois County Public Health Department for those grants, IMH is only allowed those indirect cost rates on the first $25,000. So I invited Chuck Bowman over to watch the webinar with me. They came over, he watched part of the webinar with me. We had a big meeting. I invited Ellen, who runs the program. And to make a long story very short, we agreed that the best thing for the community would be for IMH to apply directly for those grants rather than Iroquois County Public Health Department applying for those 3 grants. More money would be able to be captured through the grant and used for the residents of Iroquois County, rather than not being able to capture those amounts because you can't use your indirect cost rate. And Iroquois Memorial Hospital has a bigger indirect cost rate for us because they're in a separate building. They have to have their own copy machines, they have to have their own telephone, all those things that are needed in order to provide those programs. So we agreed that that I would have that I would pursue with the state permission for us to not apply and for Ikram Memorial Hospital to apply to be the direct grantee. After unbelievable amounts of emails and phone calls with all the 3 department heads from DHS, the department heads for WIC, Family Case Management, and HFI, we actually got responses from 2 of those. Lisa Jane Caston, who's the department head for Family Case Management, was very concerned about the eligibility in the NOFOs. The NOFOs are the Notice for Funding Opportunities, because those eligibility requirements were very strict. But they determined that because that specific NOFO said you had to have 5 years of experience in handling that particular grant, even though Ikram Memorial Hospital hasn't, the staff is the same staff that had the experience at the previous health department.
So which programs does that affect then?
So we
Does it
wanted
cover more than one?
we wanted all 3: Family Case Management, Healthy Families, Illinois, and WIC.
So what's that do to your workload in there?
Nothing, because we don't run those out of our health department. 100% of the
That's all done.
grant is all done over there by their employees.
So it's only just reported through them?
Yeah, to be honest with you, quite frankly, the best way to tell you is that we were the grantee on paper only.
Right.
And then all the monies that were paid to us for subcontracting went right back to them. Iroquois County Public Health Department broke exactly even on those programs last year. We did not, every penny that we received went right back to IMH, and then we also did their billing for their Medi money. We subtracted our time for our biller, and then gave them a check above and beyond the grant amount for their Medi billing. So it was a complete break-even case scenario, which could not happen this year because of the new VADA requirement. So, to make a long story short, Family Case Management and HFI Department of Human Service Directors both agreed that Iroquois Memorial Hospital met the eligibility criteria to apply for those grants. So that's been taken care of. The only one that I never heard from was Stephanie Buss, who runs the WIC program. The WIC grant came out on June 18th, May 18th. On May 19th, late in the day, by the way, on May 19th, early morning, I started sending emails and making phone calls directly to her and to her staff, explaining the situation about how we subcontract these programs and how that not being able to claim those indirect costs of the last portion of, anything beyond $25,000 of the grant, how that would affect our community. So I followed up with, I did all the initial stuff on the 19th, I followed up with phone calls on the 20th, I followed up with another email, very long, very detailed email on the 24th of May. The WIC grant was due May 31st. Okay, so it came out on the 18th, it was due the 31st. No response. Couldn't get anyone that would answer any questions. On May 31st, I held a special board of health meeting here in the county board room, and asked permission from the Board of Health to not apply for those grants, to be able to allow Iroquois Memorial Hospital to apply for those grants. That was approved unanimously. And then that afternoon of May 31st, I went over to the hospital, and I had typically written the grants before, so I helped Ellen and Lori Yelnick and the people at the hospital write these grants, and they had them submitted by the end of the day on the 31st when they were due. On June 1st, I finally get a response from Stephanie Beth at the Department of Human Services, and she calls me and asked me what she could do to convince me to keep the grant at the health department. So I explained the entire indirect cost rate to her. I don't think that they, at the state level, have realized the economic impact on subcontractors who were providing 100% of the service. So she told me that she would do whatever she could and call me back. And I said, okay, you know, and this is after the grant deadline. We have not applied. I am a cat. She didn't call me back Wednesday afternoon. She didn't call me back Thursday. So on Friday morning, about 10 o'clock, she sent me an email which I brought with me. And it says, find it here. It says, it's short. Deanne, after much discussion here, it has been determined that since WIC is exempt from the NOCO, that's the Notice of Opportunity Funding Opportunity, competitive application process, we cannot add any new providers this year. Iroquois Memorial Hospital is a separate entity from the health department and would be considered a new provider. Please let me know if Iroquois County Health Department will be submitting an application to provide WIC services in fiscal year 17. Thanks. So I immediately called John Shore to discuss this with him as he's the Board of Health President, and then my second phone call was to Chuck Bowman. And we all agreed that it would be best when I was on the phone call. So I immediately, after I did this, I called Stephanie Beth back and tried to argue our case. Unfortunately, they wouldn't budge. I said, well, if Iroquois County Public Health Department does not apply for this, then that means you'll need to open it up, and then Iroquois Memorial can apply, correct? And she said, no, I'm not expecting any new FIN members this year. So, she point blank said that if Iroquois County Public Health Department did not apply, that they would not be giving that grant to anyone locally. What they would do is they would offer the grant to a surrounding county. We don't want that to happen. And let's be honest, people are not going to drive an hour and a half to go get a $35 WIC coupon. Not going to happen. So, we need that to be locally for people. We don't want to put our residents in a position where they have to drive 2 hours to get services. So Chuck and I agreed that Iroquois County Public Health Department would apply for that, but at that point in time, remember, my Board of Health had just met and voted for me not to apply. So I sent Stephanie this response, and I'll read it to you. Let me see here. Get the right one. Stephanie, in light of your email and our subsequent phone conversation, Iroquois County Public Health Department is now planning to submit an application to provide WIC services in Iroquois County upon approval by the Board of Health. Because the Board of Health voted with unanimous approval not to apply in order to allow Iroquois Memorial Hospital the opportunity to apply for the program that they administer and deliver, I will need to call a special Board of Health meeting. I will need to find out when the Board of Health members are available, as I will need a quorum. Obviously, I will also need to comply with both the Open Meeting Act requirement as well as county practices, and must post the meeting agenda for a minimum of 48 hours, not including weekends. I will also need time to draft a legal agreement with Iroquois Memorial Hospital prior to board approval. It will also take time to change the budget in the WIC application due to the GOTA and direct cost requirements for grant subcontractors, which was the biggest issue why it would have been best for all parties, including clients, to have Iroquois Memorial Hospital become the grantee of the WIC program. In light of all these needed processes, I am requesting at least a week to complete the necessary actions. Please let me know if you are agreeable to my request. Sincerely. So I received an email back from her, 2 sentences. Deanne, thanks for the quick follow-up from our phone call this AM. We would be happy to accept your application by next Friday, June 10th. So basically, they're giving me a week, which we're in the process. So I have called a special board meeting for tomorrow evening, which we posted yesterday to meet the 48 hours.
Does she have the sole,
yes.
to do the extension even?
She does. She's it. The only, I'm sure if I went to the entire DHS director, he's going to support his director.
She would have, next step, then it would have been an appeal process, et cetera?
Here's what happened. The WIC applied for it, because that's a federal grant. The other two grants are state grants, but WIC is a federal grant. She applied to the Fed for an exemption from the NOFO, from the Notice of Funding Opportunity. So they did not publish it out in the public. They gave it to, they're keeping it with the people who had the grants in previous years. Because the deadline, now remember, I've been emailing her since the 19th of August 31st when the deadline was due, has passed. Now they're not going to reopen it. So I'm sure that yeah, you can read between them. Anyway, so this isn't going to happen. So we're going to have to apply for the WIC grant in order to keep WIC services in our community. So I have a special board meeting that has posted yesterday, called forward tomorrow night at 7 o'clock here in the county boardroom to ask the Board of Health for approval to apply for the WIC grant and to approve a new contract agreement with IMH, which I have drafted up and already emailed to each individual Board of Health member individually, not as group, meeting exact requirements, so that they can look over and come, already having that information. So that's what's going to happen tomorrow night. So Ellen is redoing IMH's budget. I'm working on our portion of the application. Once it's approved, then we'll have it in by Friday. But so of the 3 programs that we subcontract with IMH, the only one that we will remain grantee will be WIC. The other 2 hopefully will be approved, and we won't have any problems. Yeah.
Could you help me understand why it didn't go through the first time? Why are you having to duplicate everything?
Yeah, well, I think the biggest reason truly is because once the state applied for that exemption from the NOFO, they can't open it back up because they set a deadline, and I think that if they gave the grant to IMH, a new entity with a different SIN number, then the state could be accused of not allowing it open as up.
Preferential treatment.
Yeah, yeah.
So, they didn't respond back with that information?
No.
So they just left you up in the air?
Yes.
Fend for yourself?
They did.
That's BS.
Yeah.
They were
Yeah.
just trying to force it back where it was.
Yeah.
That should have been an ultimate goal.
That's what's in Hillary's email.
So anyway, but I have to be, in all honesty with you, whenever we have called, as grantee of these 3 programs over the last 3 years, I cannot tell you, even when we call WIC, and we've spoken with the department heads, they have been very helpful and cooperative. You also have to realize, in their defense, that this is a new process for them to have a health department subcontract to a hospital. There is only 2 counties in the state of Illinois who do that, Iroquois County and Ford County. And we know the process of it, how that came about. So it is new for them as well. So I do think, for the most part, they have been very accommodating and very helpful in trying to work through all these things. Unfortunately, this time I just wasn't responded to, and nobody likes
That's the problem.
to not be responded to. Yeah.
It could have been a no answer, but a response.
Yeah. Yeah.
So
But we can't do it.
in the future, next year, 2 years from now, 3 years from now, can this whole cycle be simplified?
Well, so my next question then, when I was on the phone to her, was, so what about next year? What she said to me, and Cheryl, I actually had Cheryl come in and take notes so that we didn't have any misunderstanding. What she said was, for this year, they have an exemption from the NOFO. For this year. And when she said the word this year, she got louder. So I'm hoping that next year because they know our intentions, and we've been very clear about it, that they will allow IMH to be the grantee so that they can claim those indirect costs that they need to run the program. So, bottom line here is that I have decided to compromise with IMH. I'm going to increase my indirect cost rate, and they're going to decrease theirs so that we're more in alignment, so that this program isn't a burden on one or the other, but becomes a shared program for this year. It will be okay. It will be okay.
Now, let's just say that you, between now and next year, you move on to a bigger and better place. And IMH does the same thing. What happens when the new people meet in the middle next year? A lot of things get lost in directions like that.
Sure. I think that because this is so new, this new guidance is so new with the state, that next year, I'm hoping that we are given more notice about what's going to be happening. Remember, I said that the WIC grant came out on May 18th. We didn't even find out about the indirect costs. The state didn't even do the webinar until the 25th, and the grant was due the 31st. So this all happened in a very quick, very short period of time. Very short period of time. You should have seen my emails blow up from other health department administrators complaining, But I think that that's because this is all new to everyone. Hopefully next year, things will be in a more, what I would consider appropriate time frame of notification. So any administrator for any health department should have, at that point in time, more notice to act upon, those things.
Yeah, that's,
I will say this, and I definitely want to say this, and I want to publicly acknowledge that through this entire process, I could not have asked for a better community partner than IMH. Chuck Bowman is extremely, he will take my phone calls, even if he's out of the office, he will always call me back. He is extremely concerned and engaged in the services that they provide to the community, and I don't think we could ask for a better community partner as far as participation. He's been fabulous.
good. That's really good to hear.
Very knowledgeable and intelligent man, but very compassionate when it comes to providing services for the community. And I think we're very fortunate. So with all that being said, I'll get that application in by Friday. The last thing I have for you is state budget, where we're at with the state budget. To date, the state of Illinois owes Iroquois County Public Health Department $156,054.78. Of that amount, $130,144.95 is specifically HFI program.
Is what?
The HFI program, Healthy Families Illinois, that we subcontract to the hospital. So really, only about $6,000.
How many days out is that?
Pardon me?
How many days out?
We have not received anything since July.
What's the aging on it?
We have,
60 days, 90 days?
no, we haven't received a claim from them since July 1st, 2015.
So it's 12 months.
Yeah. And that grant ends June 30th of this month.
So
We've been told that until there's a state budget that we won't receive payment.
at what point can you cover it?
Well, you are looking at the revenue and expense report. Note that on that, you're looking at, and I, like I said, you heard me say to Anita that I haven't seen this yet. She gave me a copy when she gave you a copy, but she probably sent it to my emails this morning, and I just haven't had a chance to get into my email. So, if you look at the
I mean, it shows it 9,000, 10,000 in the rear.
yeah, and the state owes us $26,000 for Iroquois County Public Health Department program. That's not a lot. They owe us that at any given time.
Year to date
You
is
know.
726 in the rear.
So it's the Healthy Families of Illinois program that is the biggest portion that they're not paying to us. So if you look at the
But I mean,
It is.
at what point doesn't it cover, can't you cover it? And then what happens?
well, I haven't had to, at this point in time, to come to the county and ask to have the budget open to get into the reserve now. So, hopefully our revenue on our other programs will be enough to do that. I'll have appropriations for tax levy appropriations coming in July, in September, and in November.
Because here's just...
I know what you're
Just
saying.
being the advocate, here's my fear. Let's say you want to get in there, or you want that covered, but I guarantee you, if that's happening, you're not going to be the only one.
Oh,
So
yeah.
then there's going to be a line.
Oh, there is.
It'll be like dominoes when that happens.
We were told that that the initial payment for that would probably be 46%. And then you'll get subsequent payments when there's a budget.
So, I mean, my suggestion would be, in the very near future, I'd start pulling some of these other health departments as well.
Well, you also have to...
Make sure you're not at the end of the line somewhere if there's a line.
Right. Well, we already had made the commitment through June 30th of this year. But remember, this is one of the grants that IMOCH is applying for. So this will not be on our line item next year, providing that the state approves them. So at this point, we're at a point where, that will
I mean,
be...
at some point, I'd call some lawmakers just so you're in front of the line.
Yes, I will do that. And actually, I have done that, and I will continue to do that. We've been very fortunate that if you look at our other programs, this is just kind of a spreadsheet I can pass around to you. This is an internal spreadsheet that I use to keep track of where we are. This one's just kind of my own, what I like. I have a line for amount billed, amount received, the check number, the date we got them, and then our grant balance. And it keeps my balance of, what I have left in that grant to spend. We're as far as state payments go, like I said, out of $156,000 the state owes us, only $26,000 of that, less than $26,000 of that, is actually for our program. Yeah, the rest of the program. The state owes us that at any given month because, you send in a monthly EDF on the 15th for the previous month's service. So you're always owed them back. So really, we're doing okay as far as that, this HFI. And Troy's absolutely correct. I need to make sure I'm present.
I mean, we deal with that all the time, bank, if you're not shut up, you'll be out.
Absolutely. I'll be diligent with that. Very diligent.
Any other questions?
Thank you for, I know it's a long meeting. I
Thank you.
appreciate
Good information. So is there any old business to come before the committee? Any new business? Hearing none, I would entertain a motion to adjourn. It's been moved. Is there a second?
Second?
Moved and second to adjourn. All in favor, say aye.
Aye.
Opposed, same sign.